If you get diagnosed with type 2 diabetes, that means that you need to change your life. Because type 2 diabetes is going to kill you in a horrible way. Type 2 diabetes will make you go blind. It will fry your kidneys so you end up on dialysis. And you're going to have a heart attack and a stroke. We treat you, like say for example you start having chest pain and you come into the emergency room. If you have type 2 diabetes that's uncontrolled especially, we're going to treat you like you've already had a heart attack at some point. You're that high of a risk for having a heart attack. So if you have type 2 diabetes that's uncontrolled, your cardiovascular risk just went way up. It's just like you're at that high of a risk. It's like you have already had a heart attack once. When you come into the clinic with a new diagnosis of diabetes, type 2 diabetes, a whole list of things that goes through my brain because I want to protect the different parts of your body. For your kidneys, we want to protect your kidneys from the diabetes because diabetes is one of the biggest causes of ending up on dialysis. And okay, side note, I have people come in all the time who say that the medication like insulin caused dialysis. No, that's not true. Treating the disease does not cause the bad outcomes. The disease is type 2 diabetes, and type 2 diabetes causes kidney failure. So you end up on dialysis. So you need to control your diabetes in order to protect your kidneys. So you got to control your blood sugar, first of all. You got to control your blood pressure, second of all. So we always start a blood pressure medication, even if you have a pretty good blood pressure, like 130/70, we still want you to take a blood pressure medication to protect your kidneys. One of those blood pressure medications is called an ACE inhibitor, like lisinopril, or an ARB, such as losartan, can help protect your kidneys. So this is something that your healthcare provider is probably going to talk to you about. How are we going to protect your kidneys? We want to protect your eyes because blindness is caused by type 2 diabetes. So if your blood sugars are out of control, you're going to go blind. So every year you need to get an eye exam, a dilated eye exam, where they actually look at the back of the eyeball to make sure that there's not problems with the blood vessels back there. If you come in with a new diagnosis of type 2 diabetes, you just found out that you have really high blood sugars, I'm going to recommend that you get an eye exam right away to get a baseline, and then you need to get follow-up eye exams every year. We want to protect your heart and your brain. So diabetes, type 2 diabetes, causes strokes and heart attacks. You need to keep your blood pressure under control. You need to quit smoking because smoking causes heart attacks and strokes. So smoking plus diabetes means you're a freaking train wreck. You're going to have a heart attack and a stroke, or both, or one or the other. Anyway, you're going to die. There's medications we use to protect your heart and your brain. There's cholesterol medicine called statins. Statins have all sorts of bad side effects and a bad rap, but they're also one of the few things in medicine that have been shown to protect you from having a stroke or a heart attack. So we generally try to get people to take a statin. Don't be surprised if your healthcare provider wants you to take a cholesterol medication. Just lowering the cholesterol is not going to help. Side note, eat more eggs because eggs are good for you. But taking other homeopathic remedies or vitamins like niacin to try to lower your cholesterol, that hasn't been shown to prevent heart attacks and strokes. But statins have been shown to prevent heart attacks and strokes. So your doctor may want you to take a cholesterol medicine, may want you to take an aspirin, but make sure that you talk to your doctor first, because there are some reasons why we don't want you to take an aspirin. So an aspirin can cause bleeding problems and ulcers and some other weird things. Gout, it can make gout worse. We want to be careful. You want to talk to your healthcare provider about these different treatments to protect you from type 2 diabetes. We want to protect your feet. Type 2 diabetes is what causes amputations. So you need to check your feet every single day. And you need to have your healthcare provider check your feet at least once a year. I wrote in a blog about one patient. When I checked his feet, I found a 6-inch hunk of metal wire sticking out. He couldn't figure out why his feet smelled so bad. That's actually why he came in, because his feet smelled so bad. But he hadn't actually checked his feet. He never checked his feet, and sometimes he didn't even take his shoes off for days and days. And so he worked in a machine shop, and at some point stepped on a hunk of metal, got embedded in his foot, caused this crazy infection, and he didn't even know it because he never checked his feet. So your healthcare provider is going to want to check your feet. With uncontrolled type 2 diabetes, you start losing feeling in your feet. You lose sensation. So you can't tell when there's a hunk of metal stuck in your foot. That's why you have to look at your feet and put lotion on it every night and make sure there's no injuries or broken open calluses that can lead to infection and diabetic foot ulcers and osteomyelitis, which is infection in the bone, and then you have to get an amputation if you can't get that treated. And it's really hard to treat foot infections when you have diabetes. If that infection gets into the bone, it's really hard to treat. And you can die from it, and so they end up needing to amputate it so that you don't die from it. So it's one of the leading causes of amputations worldwide, other than landmines and man-made things like that. Diabetes, we want to protect your feet, so we're going to be concerned about your feet. We're going to be concerned about your kidneys, so we're going to want you to pee in a cup, check your kidney function, take certain medications to protect your kidneys, quit smoking to protect your heart and your brain. We want you to protect your eyes. I feel like I'm forgetting something. Hold on a sec. And just nerves in general. Diabetes causes peripheral neuropathy, so you start having burning nerve pain, or your feet feel like they're on fire. Sometimes it goes up your legs, sometimes it starts in your hands. Diabetes and hyperinsulinemia and high blood sugars is associated with all kinds of nerve and tendon disorders like carpal tunnel syndrome and ulnar neuropathy, any kind of neuropathy and nerve pain. We want to protect you from that, and controlling your blood sugars is one of the most important things. There's a lot of other things that are caused by type 2 diabetes. Osteoporosis, increased risk for fractures like hip fractures. So weight-bearing exercise, any kind of walking every day, will lower your blood sugar and increase your bone density, so you'll have stronger bones. So you got to do weight-bearing exercise every single day. And that might just mean going for a walk or going for a swim or a bike ride. Anything that puts weight on your bones and gets your muscles moving is good exercise. So don't feel like you have to start CrossFit, although I recommend it. But just walking every single day, taking the dogs for a walk is awesome exercise. I have a guy who got his A1C under control just by going on long walks with his 2 little chihuahuas. And they walk about 5 miles a day. They just go for a walk around town. And his A1C got down below 6 just by doing that. It started out over 9. So for type 2 diabetes, exercise and a good diet can fix you. This is the difference between type 1 diabetes and type 2 diabetes. With type 2 diabetes, it's lifestyle and controlling obesity, controlling your weight, and exercising more. You can really get a handle on this disease, and you can beat it. You can live a healthy, long life.